Okay, so you are all welcome to this Reach conference work Cameroon team. The Cameroon team. So what we'll be doing of some scholars who did some good work, and our interaction with them. If you have questions for them, you can always ask. We'll move to the conclusion. And so with me, I'm supposed to have Tonga, who is the team lead for the Francophones. Barry as only focal point for Teach to Reach conference for the Anglophones. Paul Desiree Mbala, who is the focal point for Francophones. Cameroon is a bilingual country. Oh, sorry, I should maximize. Okay, Cameroon is a bilingual country, and so we have 2 country team leads for French and English and 2 focal points for French and English. So after this, I will have to minimize my screen so that I can promote them as panelists before we continue. Thank you. Please just be patient. So you are welcome. Is Barry already there? Sensei, I can't see you to promote you. So I will continue to share my screen. Please, can you still see my screen? Okay. Okay, we'll go straight away. I will look at those who are in the room. We'll listen to scholars. Please, you excuse us, it will be a bilingual session because the Cameroon team is made up of Anglophones and Francophones. So I will first of all invite, I don't know whether Atu has joined us, but I will invite Dr. Ambe to unmute himself and then give us some answers to this question. Dr. Ambe, over to you. Hello, Dr. Ambe. Hello. Yes, Dr. Ambe, are you set?
Yes, I've just changed my position.
Okay. Oh, just give me some time. Let me go to Innocencia, please. Are you there? Hello, Innocencia. Okay, so either you or Innocencia, one person is ready can take over. Let me share. So you can go ahead. Thank you.
Okay, thank you, Martha. Well, as you've already been calling, my name is Dr. Billionaire. I currently work at the Regional Delegation of Public Health in the Northwest region. But at the time when I was implementing this project, I was working at the District of Pundong as a District Medical Officer. So I actually implemented a project that was more on building the capacity of the health facility actors on routine immunization because arrival at the district, our vaccination coverage was quite very low, so we could not understand.
Hello, Dr. Ambe.
Muted me actually.
No, I think I'm sure somebody else muted, somebody at the panel muted you. There was some noise from your background. Please go ahead.
Okay, is it better now?
Yes.
All right, thank you. So as I said, that the project that I implemented was more on building the capacity of healthcare workers on routine immunization because upon district where I was working, we observed a very poor performance, and most often this poor performance had been attributed to the crisis. But when we did a situational analysis, we could realize that it was not actually due to the crisis. So after that, and then through the regional EPI team, I got to learn about Teach to Reach. So I choose now to implement this project, which is building the capacity of the healthcare workers at my health district. During the routine coordination meeting, we select a topic on immunization and we discuss on it. We talk about the practical aspects in the field, and we also
Hello. Hello. At you and the many other scholars that were supposed to present. I can't find them. So the network is not enough. Hello, Dr. Ambe.
Hello.
Yes, Barry.
Hello.
We lost Dr. Ambe. We cannot have Atu. We cannot have Innocencia. Innocencia, the network is laying down on her.
Hello.
Yes. Okay, let me invite him. That's Dr. Ambe, please continue.
Okay, thank you,
Okay,
Madam.
thank you, Madam.
I think I had some network challenges. I'm not in my region now. So I think I was at the level of what I did. I said I actually organized routine training to build the capacity of healthcare workers, and then we used the district hospital as our pilot center for practice after the coordination meeting. So I think during this process, it's following the different lessons in the Teach to Reach platform that actually made me to revise the method of like just coaching or building these healthcare workers, because sometimes we always believe that they have to sit down and undergo a formal training. But I just had to use a method that was just very basic. And I could also say by then, during that period, we were not really, the COVID-19 pandemic had not really affected my health district. So we were still having our meetings. That is why we did not use any digital application. So during the routine coordination meeting, we will follow up, especially on the request of these health facilities for vaccine management, and we'll follow up on their reports to see the progress that has been made after the training. I think that's just a summary of what I did as my project for the Teach to Reach Level 1 certification. So Martha, over to you.
Thank you, Dr. Ambe. The participants in the room may have some questions for you. Please, let me check the chat box. I don't find one for you. But you didn't tell us, okay, you said you work at the hospital. So how did you conduct the training? Give us a detailed explanation of how you conducted the training.
Actually, we have these norms and standards that is shared to all health facilities. It's shared first to the health districts and then to all health facilities. So this book, normally it often needs to be accompanied with the training, but it was just shared to the different actors. So it's just the norms and standards that I used actually, and this reach every district microplan and reach every community microplan also that we often update at a regular basis at the health district. So I use these two tools actually to ensure that the training matches with some norms. I think I also got some books I also downloaded some documents online on the management of vaccines. I think I've forgotten the name of that course that I took. It also helped me in building the capacity. There was a strong collaboration of my chief of bureau health, who actually worked closely with me because he was also very experienced in the field of immunization, but he just needed someone to boost him up for him to share all the package of experience that he has had throughout his years of work.
Okay, thank you, Dr. Ambe. There is a question for you in the chat from Igbo. Dr. Ambe, how long was the implementation of your activities? Thanks.
I could say that activity because it was implemented for 6 months, yes. That's within the time frame that I was in Fundong. But after that, there was continuation of the activities, the practical phase, but for the training, I think I did that for 6 coordination meetings. Yes, because it was just during our monthly coordination meetings. After that, we just continue with monitoring and coaching those with poor performance who had not yet picked up some other aspects.
Okay, thank you, Dr. Ambe. Any other questions for Dr. Ambe? Okay, Dr. Ambe, Igosi has another question for you. Did you or your team have did you or your team have developed a tool to measure the impact of your intervention?
Well, developing a tool, I would say no, but we already had with us we had this DVDMT that was being used at that moment for reporting immunization activities. It's true this was later on held actors were briefed on using the DHIS2 platform for the reporting of immunization activities. So that is just what we used to follow the progress, like the improvement of the vaccination coverage in the health district. So we did it as simple as that.
Okay, thank you, Dr. Ambe. Any more questions for? Okay, so we have another question from Dr. Tanji. To communicate with your team, did you face any challenge?
Well, for communication, I think I did not really face any significant challenges to communicate with the actors. The different health facility actors, actually, they really embraced the idea, because I could, after the training, I could see some people even actually had to call me and ask other personal questions. So I did not really have any challenge communicating with the different teams, the health area teams.
Okay, thank you. Thank you, Dr. Mike is okay with your response. So thank you very much. We're supposed to have scholars who are presenting their project implemented in French and in English, but the network is not really friendly for the past 3 days in Cameroon, so they keep on connecting. That notwithstanding, okay, the next person, I'm free to see him.
It's kind of unfortunate the moderator, Madam Massa, is not online. But however, I think I need to put forth my project which I implemented for the Teach to Reach program, right?
Yes.
Okay. So actually, the project which I implemented was the Teach to Reach level 1 creator creator project. That was what I actually implemented. And my project, the topic of my project was preventing immunization rejection and self-evaluation. How immunization workers can evaluate and self-evaluate and know the feedback of their work, of what they are doing. Yes, work I actually worked on. Well, this project had to do with identifying, in order to identify the reasons, the causes of immunization rejection, and suggesting and making proposals and solutions on how to overcome these causes. Yes, and some of the causes which I was able to identify in this project was things like fear. You know, there are some communities that will be hesitant to accept the vaccine because of fear. Maybe they're just afraid. The lack of knowledge can make them to be afraid of accepting this vaccine. So it will lead to rejection of immunization. And also, I also equally outlined breach of trust, breach of cultural beliefs, breach of norms. You know, communities vary in their values and their norms. What may be accepted in one community could not be accepted in another community. So those are some of the differences that I was able to outline in this project. And now the ways of handling these causes, these causes of immunization rejection. Some of the practical ways which I was able to outline include engaging the population into the project. engaging the community, that's bringing the community involved into the immunization campaign itself. Sometimes you may even actually need to recruit workers from this community to carry out this activity. And equally, sometimes you may equally need to pass through their chiefs and their traditional rulers and so on. So you get the community engaged. That will go a long way in preventing immunization rejection. And equally, as some of the solutions, another second part of the project was the formative self-evaluation techniques. You know, it's very important. I think it's very vital if you are carrying out any project. You should, in order for you to stay cost effective and remain within the timeline, you should be able to evaluate yourself. You should be able to self-evaluate and know if you're on the right track or you're on the wrong track. So I think that is equally very important in an immunization process or in an immunization campaign. Yes, and this can be done by regularly getting feedbacks from the population, and equally the campaign workers could organize themselves into groups and for discussions and so on. Hello? Yes, so that was the project I worked on. Okay, Madam Mata, welcome back. I was just describing the project which I implemented during the Teach to Reach program, which was my Teach to Reach Level 1 certification, Teach to Reach Level 1 certification creator project.
Okay, thank you.
So that was what I actually implemented. Yes.
Solange, over, please. You can.
Hello, Martha. Hello, everyone.
Hello, Martha. Hello, everyone.
Thanks for giving me the floor.
Thanks
I'm very
for
happy
giving me
to
the
be
floor.
part of this
I'm
session.
very happy to be part of this session.
Yes, my project regarding the
Yes, my project regarding the Teach to Reach on
statistical data analysis or
statistical data analysis or survey data.
I've not already implemented
it because it needs
the method to be correctly how I'm going to fill the gap of statistical data analysis among immunization professionals. So I'm still working on it. It needs computer system, it needs programs to be able to generate expect. So hope you are getting me because it seems like there is a noise in the communication. So my project was, like I say, especially on how to use the survey data to generate secondary data analysis after the main source. As I said, but I'm still working on it to strengthen the plan, the training in such a way that I'll be able to teach, I'll be able to make people understand and fill that gap more professionals have in data analysis. Okay, thank you, Martha.
Okay, thank you, Solange. Unfortunately, we have some of the scholars who wanted to present. They are joining us just now because of the network challenge, but we are supposed to go back according to the message you are just receiving, that at 4:30 we are supposed to go back to the next session. So we are sorry for all the internet interruption, but we hope that the little time we spend together, we could interact and learn something. Thank you so much. And bye, you can go back to other sessions.